My name's Jordy File, and I am going to be talking about anorexia nervosa. And anorexia nervosa is an eating disorder characterized by extreme reduction in energy intake relative to requirements, leading to significantly low body weight. With anorexia nervosa, there is extreme weight loss, a distorted body image, and an irrational fear of weight gain and obesity. Nervosa is a term that refers to an attitude of disgust with one's own body, and people who have anorexia nervosa irrationally believe that they are fat and they want to be thin, and no matter how thin that they get, they still perceive themselves as being fat. I chose to talk about this disorder because I am a cross-country runner, and I have had several teammates struggle with eating disorders. I also want to become a collegiate cross-country and track and field coach, and I am certain that I will encounter athletes who are struggling with eating disorders. Eating disorders are prevalent in distance runners because one is required to carry their weight a certain distance, and if they have less weight, then it's easier for them and they can often run faster. Athletes who participate in sports that have weight classes like boxing and wrestling are often more likely to develop anorexia nervosa, and then athletes who participate in aesthetic sports like dancing and swimming are also more likely. Some people with anorexia nervosa will binge or eat large amounts of food, and then they eat this food in a short amount of time, and then they feel guilty and they will want to participate in activities that will compensate for the large amount of food that they just consumed, and they'll do this by purging, which can be vomiting, using laxatives, diuretics, or exercising excessively. People with anorexia often become irritable and hostile, and they tend to withdraw from those who they are close to, like their family and their friends. The effects of anorexia nervosa can be reversed after returning to a healthy body weight, but if they've been in this state for a long time, then some of the effects will never go back to completely normal. Some of the physical effects of anorexia nervosa are low body temperature, easy bruising, low metabolic rate, and a cold intolerance because they don't have a lot of body fat, hair loss, fainting and fatigue, loss of heart tissue. There's little subcutaneous fat, the loss of the menstrual cycles, low bone mass, muscle tears and stress fractures, iron deficiency, which is anemia, blood potassium imbalance, irregular heart rate, dental decay, constipation, sleep disturbances, immune dysfunction, infertility, and lanugo. And lanugo is whenever hairs grow on the body and they appear in an attempt to try and keep the body heat in the body because there's so little body fat. Some treatment for anorexia nervosa is difficult because in addition to having an eating disorder, there is also a mental component of it, and the treatment of the disease includes a lot of counseling and even some time in the hospital. Treatment is expensive and it is usually extremely extensive. The average time of recovery for anorexia is 7 years. Unfortunately, many insurance companies do not help much in reducing the cost for these types of treatments, and so many people go untreated. Nutrition therapy is very hard for the patients because the goal is to increase their oral food intake, and whenever the patient begins to gain weight, then they often feel like they're losing control because eating disorders are often a way for that person to experience control, and they can control how much food is going into their bodies. First, the immediate physical problems of anorexia nervosa are addressed, and then the treatment changes to focus on the underlying emotional issues that led to the development of the disease. If anorexia nervosa continues in someone's life, there is the potential for death, and the heart becomes too weak to continue to work, and those with anorexia nervosa can go into comas, or they can even die from cardiac failure. The resources that I used to get this information were from Wardlaw's Contemporary Nutrition textbook and from the Mayo Clinic. And my name is Jordy File. Thanks.